Hello everyone, this is Dr. Uma. Today I am going to talk about restraining of children. Shall we move to next slide? First we will see about meaning of restraints. So restraints are the devices which is used for immobilize the children completely or partially during the time of various nursing and medical procedures. So this is very simple to understand that restraint is a kind of devices which can be used to immobilize the children, especially during the time of any various nursing or medical procedures. So basically it make the children not to move. So next we'll see about purposes of restraints. The ultimate purpose of restraints is immobilize the children, okay, especially during the any medical and surgical procedures, especially physical examination, intravenous fluid administration, etc. Then second purpose we can tell that it helps to make the child quiet. Next we will discuss about points to be remembered. So these are some of the points that we have to keep in our mind during the restraining the children. Number one, proper explanation. We have to give proper explanation regarding the reason for restraining the children, especially to both parents also the children, if they understand. Next one is the diversion therapy. We have to divert the mind of the child while applying the restraints. Suppose without diversion therapy, if you apply the restraints over the children, they may oppose the restraining movement. Next one is the adolescents are requiring some diversion therapy to pass the time with the restraints applied for a long time, right? So adolescence is the age that they used to do so many activities a day, so they don't want to sit on one place, so basically they need some diversional activity to pass the time. Next one is the restraints must not be applied too tightly, too loosely. Of course, if you apply the restraints too tightly, definitely it can cause skin irritation, and it can stop circulation also. And or if you apply the restraints too loosely, we will not achieve the purpose. Next one is the sufficient padding must be applied over the area to prevent skin irritation. Sufficient padding in the sense we can keep cottons or any gauze piece just below the restraints. It will prevent the skin irritation. Next one is the superize the area of the restraints at least every 15 to 30 minutes to find out whether restraints are in correct position and constricting the respiration or circulation. So the restraints may can irritate the skin. Also, suppose the position changed, it can stop the respiration or circulation even. So what we have to do, every 15 to 30 minutes we have to check the restraint position. Next one is the periodically every 2 hours once we have to remove the restraints if it is permitted, and allow the child to stay for sometimes free without restraints if it is possible only. Suppose some restraints are there that should be applied such a long time, means we cannot do anything, but just try to remove every 2 hours once, it can permitted. Next we are going to discuss about types of restraints. We have nearly here 7 types. The first one is the mummy restraints, second jacket restraints, third elbow restraints, fourth extremity or glove hitch restraints, fifth abdomen restraint, sixth grip with dome, seventh is the Papoose board restraints. We are going to see one by one. The first one is the mummy restraints. This is very important type of restraints. How to do this? Actually, first of all, we have to take one towel. That towel corner, one corner should be folded towards the towel. Afterwards, we have to keep the baby on the towel. That the corner area should be very near to the head and neck. Okay. Then afterwards, pull and firmly tuck the one side of the towel over the opposite shoulder, like like this. You take one side and just tuck, firmly tuck over the opposite side. Then afterwards, pull and firmly tuck the other side of the towel over the opposite shoulder. So first you apply this side and afterwards this side. It's covered the children. Then finally pull and secure the side of the lower extremity. We have to take the lower extremity and take it to upward and tie it. This is the mummy restraint technique. So what's the purpose? Number one very important purpose is immobilization of the arms of infants during the examination and treatment of the head and neck and prevention of hypothermia in newborn. So the main purpose extremities, otherwise the whole body immobilization. So especially if you do any procedure or any treatment over the head and face, also it can be very useful in newborn to prevent the hypothermia. This is about jacket restraints. Jacket restraint is the kind of restraint. It will help to immobilize the both chest and back of the child with the help of the rope, and child cannot move anywhere. It is also having danger of strangulation due to slipping of the jacket restraint. So during the application and follow, we have to be very careful. So what's the purpose? It will help the child to stay calm in the bed. Also it will prevent the falling from the heighted place. This is about elbow restraints. Elbow restraints can be made with a double piece of cotton cloth with pockets on. To make the elbow restraints, we have to take two pieces of cotton cloth that should be kept each other. After keeping that, we can make a parallel stitching like this. This is the parallel stitching. Once parallel stitching is made, we can insert the tongue blade, otherwise any wooden blades. Once wooden blade is inserted, if you want, we can close the packet also if it is needed. Then we can also stitch two side any tie also. So after making the elbow restraints, we can keep the hand of the child. After application of the cotton pad, we can tie it properly. So tongue blade should be in the proper length to cover the whole length from the axilla and wrist. So the size of the elbow restraint should be according to the hand size of the child only. And what is the purpose? It will help to hold the elbow in extended position, especially during administration of IV fluids and the surgery which is involved in the head and face. Also for eczema child, we can use elbow restraint to avoid the scratching of the face and the head. Next is extremity or clove hitch restraints. To make the extremity restraints, we have to take gauze strip with 2 inches wide and the length according to the requirement, especially the amount which you want to encircle the child wrist or ankle. First of all, we have to make one figure of 8 in gauze strip. After that, keep the cotton pad over the wrist or ankle area. Then place the circle of the restraints around the padding and the extremity and tie the end. This is what you have to do it. After finishing this, the tie should be attached with any bed frame. So what are the purposes? Only the main purpose is that help the child not to move, especially the upper or lower extremities. This is about abdomen restraint. Abdomen restraints can be applied over the children's abdomen. These are having rope in 2 sides like here. And after keeping the baby over the abdomen restraints, we can tie on the bedside rails. What is the purpose? This will help to maintain the supine position of the children over the bed. This is the main purpose of the abdomen. This is about grip with dome. So the grip net, this is called grip net. It can be applied over the top and the side of the child bed tightly after keeping the baby inside. Then it will prevent the falling from the bed by infant or toddler, and also it enhances the movement of the children inside the dome freely and safely. The last type is Papoose board restraints. The Papoose board restraints is prepared with using splint principles of binding the child to a rigid board to prevent movement. It is also having 3 sets of opposing belt with hook that fold over the child's body. So these are the 3 sets of opposing belt. It can be covered the child's body. It will prevent the movement. And it is also having 4 arm or wrist strap. This strap can be useful to immobilize the arm especially. Also it is having one head strap, that head strap can be immobilize the child's head. Okay, so during the time of immobilization, any part of the body can be exposed for the assessment and need according to the treatment. So next purpose of board is to restraining the injured and frightened children temporarily and also quickly for medical and nursing procedure, especially during the time of X-ray or CT scan assessment. For X-ray and CT scan, we have to keep the baby inside the machine, otherwise on the table such a long time. If you apply Papoose board, it will be make the child stay calm and quiet. So thank you so much for listening to today. If you have any doubt, please write in comment section. Bye bye. Have a nice day.